Center for Global Health is a university-wide center. It involves representatives from about 14 units across campus. And our mission is to work on global health problems, both broadly as well as with respect to inequalities in health across the world. What we aim to do is to help catalyze what is already happening and to work with other partners that are already engaged in the area to do work and to start projects that would not have happened without the presence of the center. The center itself will probably focus on a few key partners, probably in Africa, particularly Ghana, South Africa, and the Middle East, as well as places like China and some countries in Central and South America. In terms of the major public health issues, I think the world is going through what we call the epidemiologic transition, which means a shift from burden of disease being due to infectious diseases to a chronic disease, burden of disease model. We are seeing in most countries of the world that infectious diseases are contributing less to death and disability, and chronic diseases like diabetes and cancer and heart disease are contributing more and more. There are many obstacles to getting public healthy. I think one of the biggest obstacles we face is that we are realizing that our health is shaped by large processes that influence our daily life, including, for example, urbanization, our greater tendency to live in cities, including global environmental climate change, including the health systems. And the challenge in improving the health of the public, it will be to work not only with individuals about their behavior, but also with these larger systemic processes. There are many reasons why we should care about the health of the rest of the world. I think the first reason probably is an altruistic one. We should care because we are part of a global human community. A second reason, perhaps a bit more looking close to home reason, is that we know at this point that investment in health in countries other than our own is an investment in our own security. We know that health is linked to stability. Countries that are healthy, whose citizens feel they have access to the resources to lead a healthy, productive life, are much more likely to be our allies. Different projects operate differently. We have a project right now, it's working in Ghana, which is funded by the Gates Foundation, where we are partnered with 2 universities in Ghana, and our faculty and their faculty do a lot of sharing of resources. We have our faculty going over there, their faculty coming over here. Together, we are developing research projects to address the question of how we can get physicians to go to rural areas. And together, we will work on developing solutions. We will engage in both projects that are purely research projects as well as projects that are intervention projects. And we will also undertake some work that is designed specifically to influence policymakers and to shape policy. We are aiming to engage the university community and to make the university a vocal player in the academic discourse about global health.